Well, hello and good evening, everyone. It's absolutely lovely to see you here, and thank you very, very much for joining our second webinar this evening. My name is Angela Jones. I'm the Clinic Operations Manager here at Bridge. We are a relatively new fertility clinic in central London, and we're committed to providing accessible, affordable, and above all, compassionate care to all of our patients. I'm delighted to welcome you, as I said, to the second in our series of webinars, and this one's entitled Egg Freezing, Why, When and How, and to introduce our speakers tonight. Unfortunately, clinical embryologist Dina Abdo is unable to join us, so we are very grateful to Marta Jansa Perez, our Director of Embryology, who will be presenting on her behalf, so thank you, Marta. Marta will then hand over to Angela Pericleous-Smith, our Senior Specialist Fertility Counsellor, so thank you to her too. So before we start, just some housekeeping, please. This webinar will be recorded as you'd expect, and the link will be available on our website for you to catch up on. And the chat function will be open all throughout the webinar, so please do take the opportunity to add some questions in, and we'll take the chance at a halfway point to address the questions raised, and again at the very end too. So I'll now hand over to Marta, and thank you very much.
Thank you, Angela. I'm going to try and share my screen. If you can just check that it's working and let me know, that would be very good. Is everything okay?
Everything's fine. Thank you very much, Marta.
Lovely, lovely, lovely. Thank you. Thanks for the introduction, and thanks everyone for joining us tonight. I am delighted to be here covering this subject of egg freezing, why, when and how, and hopefully it will be helpful to people in the audience who are considering egg freezing for whatever the reason, and we're going to go through the reasons as I go through the presentation. As Angela has said, Dina Abdo, who is our clinical embryologist and quality manager, is unable to join us tonight because she's unwell, so we wish her well, and I will cover this subject today. I will stop at the end of my slides for some questions if anyone has any, and later on at the end we can have a further discussion once Angela has covered the counselling side of egg freezing. So as Angela said, we are a clinic in central London. We pride ourselves by being a very highly skilled and trained multidisciplinary team that we have in common, that we put the patients at the center of what we do, and patient-centered care and evidence-based care is what we provide. We make sure patients understand what they're getting into when they come to see us, and we make sure that they make informed choices about the treatment that they embark on. And as part of that, we also provide very transparent prices so that people can budget for the fertility treatment that they require. So I've put the website for our clinic there for anyone to have a look at their leisure. And of course, if anyone has any questions about the website, very happy to address them at any stage. So starting with freezing, and in general, what does it mean to freeze cells? So in fertility clinics, we have traditionally, over the years, frozen a lot of sperm, eggs, and embryos. And this has allowed us to keep them in storage, essentially frozen in time for future treatment. And it's a great tool for patients who want to have material in storage and use it later on. However, it's technically quite challenging, and some of the cells that we freeze are more challenging than others, and I will explain that a bit more as we move along. But first of all, I wanted to show you an image of where we store the egg, sperm, and embryos. These tanks there are tanks that contain liquid nitrogen, which is at a temperature of minus 196. And in there, the cells are frozen in straws like the ones you see in this slide. What is important to know is that those tanks are constantly monitored for regular temperature, and therefore we know for sure that at all times the temperature is maintained. We have alarm systems that would alert us if there was any problems, and we would be able to transfer samples to a new tank. So the samples there are very, very safely stored and safely monitored, and we are very, very reassured ourselves that there is a minimal risk of anything going wrong with the samples in storage. Now, focusing on what it is to freeze cells, we know that human cells contain a large amount of water, on average 70%. But some cells, particularly eggs, which is the biggest cell in the human body, have the highest water content, and that makes them particularly challenging to freeze, because cooling cells with water in them will produce ice crystals, and those ice crystals will kill the cells by breaking the cell membrane. So the challenge we face when we freeze any cells, but in particularly eggs, because they're so big, is to remove that water and replace it by what's called cryoprotectants. And those cryoprotectants don't form ice crystals and allow us to store that material at very low temperature with minimal risk of damage. And over the years, we have used two techniques mainly to cryopreserve eggs. One is called slow freezing, and the other one is called vitrification. With either technique, what we do is, as you see in this slide, put cryoprotectants inside of the egg and remove the water. And we do that by putting the egg in a solution where there is cryoprotectants, but also permeating elements that allow the water to come out and the cryoprotectants to go in. And this is essentially how it works in principle. And as I say, there is two main techniques that have been used over the years, but in the last 5 to 10 years, we all moved to what's called vitrification, which is a rapid cryopreservation technique that has given us really very, very good results with regards to eggs. This technique has been really polished and perfected in the last 5 years, as I say, and we now use it routinely for freezing eggs. And what it allows us to do is be more efficient in the way we remove this water out of the cells, but also it means that we have a much quicker cooling rate of the eggs that increases egg survival. And in this slide, I'm also showing you data from the HFEA register that shows how in the last few years, not only the amount of embryo storage has increased, but the amount of egg storage has dramatically increased. And this is related to the fact that we're now much more skilled with the technology that we have at freezing eggs and giving them a good survival rate and a good chance of pregnancy once they're thawed. And it is important to know that a lot of the egg freezing that we do is to do with women that want to freeze their eggs and delay motherhood for a later date when they're more ready to start a family. And I'll cover that shortly as well, the different reasons. But first, I wanted to go through what the treatment pathway is when a patient comes to us considering freezing their eggs. What we do is we have a first consultation with the patient, and at that consultation, we will do mainly two tests. One is an assessment scan that allows us to assess not just the ovaries, but also the uterus and all of the pelvic cavity. And during that scan, what we do is we count the follicles in the ovaries. It's called the antral follicle count. That gives us an idea of what the ovarian reserve for the patient is and of how we could stimulate the ovaries to optimize the number of eggs that we would be able to collect. And we also do a blood test where we measure a hormone called anti-Mullerian hormone, which tells us again about the ovarian reserve. So those two results allow us to tailor the stimulation of the ovaries for that patient in a way that we maximize the number of mature eggs that we collect, but we don't put the patient's health at risk by giving them ovarian hyperstimulation syndrome. So after that consultation, if you follow the pathway through to the right, the clinicians will review the results, and we will then have another discussion with the patient where the treatment protocol is agreed. And at that consultation, we will explain the protocol in detail, and we will make sure that the patient understands what they're embarking in. We will also do some virology screening tests, because anyone who stores cells for future fertility treatment needs to have blood tests for hepatitis B, C, and HIV. And this is to make sure that we store the material in the conditions that are appropriate for the different types of patients. Majority of the patients we treat are negative for those 3 tests that I mentioned, but we can also treat and store eggs, sperm, and embryos for patients who are either positive for hepatitis B, C, or HIV. And that allows us to decide in which storage tanks we should place the eggs in storage. After that, the patients will sign consents. We have an online platform which is really, really very good for patients, because in that platform we have all of the patient information in the shape of patient information sheets, but also we have videos that the patients have to watch and answer several questions, after which we get reassurance that the patients understand. If there is any questions about the information or about the consents, we're always here to help. So it doesn't all need to be online. These consents are complicated, and there are important choices to be made about the conditions of storage. For example, decide what would you want to happen to your eggs in storage if you were to get mentally incapacitated or if you were to die. And those are very important choices that we will support you in making. So even though there's the online platform that is really very helpful, we're always here to discuss any options you might be unsure about. And consents are signed at that point, but again, they can be re-signed later on, and choices can be changed right through to the point where we collect the eggs and we freeze them. Then the patients embark in ovarian stimulation, and as I say, these will be tailored according to the ovarian reserve of each patient, and we will monitor how the follicles are growing in the ovaries regularly by doing scans and sometimes blood tests. And at the point when we have at least 3 follicles that are above a certain size, usually it's 18 millimeters, we will give the patients a trigger injection. And what that injection does is it triggers the maturation in the eggs that are growing in the follicles in the ovaries. And what we do is we will plan the egg collection 36 hours after that injection. And the aim for that is that we collect the eggs from the ovaries before they are released into the fallopian tube, which would happen if we let 42 hours pass after the injection. This is on average the time when the eggs start coming out of the ovaries and getting into the fallopian tube. So by doing that at 36 hours, we essentially avoid eggs being released, and we maximize the proportion of the eggs that we collect that are mature. So we will do the egg collection, and after the egg collection, within 2 hours of the egg collection, we will remove all of the cells that are around the egg. And those are the cells that we call the cumulus cells, that essentially protect and nourish the egg as it grows in the follicle. And without those cells, we are able to visualize under the microscope which of the eggs are mature. And it's only the mature eggs that we can vitrify. It's widely proven that mature eggs, with the technologies that we have available to us at the moment, will not give us a good survival rate or chances of pregnancy. We know from all of the data over the years that by managing the cycles in this way, we get on average 80% of the eggs that we collect to be mature. And this is again to set patients' expectations, to make sure that people understand that it's not all of the eggs that we collect that we on average are able to vitrify, but majority of eggs. What we will do once we've finished with the egg vitrification process, we will call the patient and we will let them know how many eggs we have in storage. And the day after the egg collection, again, we will call the patient just to make sure that they're recovering well from the egg collection procedure, which is a minor surgery procedure, and to make sure they are okay, also emotionally. And Angela will talk more about the emotional side of the egg vitrification process. And we'll also follow up 1 week later, again, to make sure that the patients have made full recovery. And thereafter, we'll contact patients once a year just to touch base and to collect the storage fee that we collect every year. And patients have the choice to keep the eggs in storage for as many years as they have consented to. And this is with intervals of 10 years, after which they need to renew the consent. But we're now lucky that the law has changed and we're able to store eggs for up to 55 years. Those eggs can also be removed from storage at any point during that period just by signing a consent form that allows us to move them out of storage. So I'm just going to cover the multiple reasons why people might want to freeze eggs or vitrify eggs, which is, as I said, what we're using now. A lot of patients have treatment, medical treatment, that will put their future fertility at risk. And that includes patients that are going to undergo cancer treatment, either chemotherapy or radiotherapy. And for those patients, it's highly recommended that before they have that treatment, they consider the possibility of freezing eggs. And those patients go through a very difficult period of a cancer diagnosis and the possibility of freezing eggs if there is time for that. And that's something that we're very well aware of. And for this group of patients, we will liaise very carefully with the oncology teams where they're being treated to make sure that we provide continuous and consistent care. There's also patients, for example, who will transition from one gender to another. And as part of this process, they will potentially lose the ability of either producing eggs or sperm. And those patients can cryopreserve eggs or sperm before they transition. And those can be used at a later date to attempt to create a family when they're ready to do so. There is what we call social egg freezing, and this is for women who are not ready to start a family, but who might want to store eggs with the view that if later on, when they're ready to start a family, they have difficulties conceiving with natural intercourse with a male partner, they might be able to use the eggs we have in storage. And those are people that might freeze eggs at a young age and keep them in storage until they attempt to start a family. And if they don't manage to do it naturally, then they can use those frozen eggs. We're also freezing eggs for egg donation programs, and this is a very exciting development because it opens up access to egg donation services to patients who perhaps in the past would struggle to find an egg donor. And egg banks are being developed now with eggs in storage that really give patients a good chance of getting pregnant with egg donations. Some patients might want to freeze eggs for ethical reasons or religious reasons if they don't want to create more embryos than those that they will use in a fresh treatment cycle, and that is also a possibility. And occasionally we are unable to get a sperm sample on the day of egg collection if the male sample has difficulty producing a sample, and for those patients, again, we can freeze the eggs and use them for treatment at a later date. Often patients will ask us, when is the best time to freeze eggs? What are the chances of achieving a pregnancy with those frozen eggs? What age should I freeze eggs? How many eggs should I freeze? And these are very, very valid questions, and those the answers to those questions are important in terms of making decisions. So most important thing, even for fresh IVF, is the age of the woman that produces the eggs is the more strong indicator of the chances of success. But using frozen eggs, that age is even more crucial. And we know that when women go over the age of 37, the chances of conceiving with frozen eggs, frozen after 37, I should say, really drop quite dramatically. So in general, as you can see in this slide, if you're around the age of 34, you need about 10 eggs in storage to achieve a 75% cumulative live birth rate. And what that means is your chances of conceiving by using all of those eggs. So not per treatment cycle, but using all of the eggs that you might have in storage. If you're 37, you need 20 oocytes in storage to be able to achieve that chance. And if you're 42, you would need 61 eggs, which is why for women that are over 40 and even slightly younger, we don't really recommend to freeze eggs, or we make sure that patients understand that if they proceed with egg freezing at an age which is over 40 years old, they understand that the chances realistically to have a baby after warming those eggs are really quite low. But even in younger, healthy patients, in order to get a good chance of pregnancy, we might need to do 2 stimulation cycles to get a good number of eggs in storage. And that's something, again, that people should be aware of when they're counseled in order to do fertility preservation. And I'm just putting here a couple of references which we used, and also to highlight the fact that professional guidelines have been reviewed recently, and Dima and Angela are part of the professional group that have written these guidelines that really assist us professionals in providing evidence-based care when it comes to egg cryopreservation for patients. And I just wanted to end by thanking everyone for listening. As I said, I wanted to show you a photo of the team, but we are in the process of transitioning into our new website, and unfortunately this link won't work, but please have a look at our website. We have a very, very skilled and caring multidisciplinary team that is happy to answer any questions about this or any other treatment at any point in time if you want to reach out. And thank you very much.
Hi, Marta. Thank you so much for that. That was absolutely wonderful. We do have just one or two sort of questions that have come through on the chat here for me. I'll start off with this one. What can I do with my frozen eggs if I have them in storage and no longer want to use them? How would you answer that one?
Yes, thank you, Angela. That's a very good question. So, as I said, people have choices throughout the period where they have their eggs in storage, and there's no obligation to keep them in storage if, for example, people have completed their family by conceiving naturally. And at any point in time, people can consent to either discard the eggs, and those eggs can be disposed of safely in the lab, but they can also be taken home by patients to dispose of them in whatever way they feel comfortable with. But also patients can consider donating those eggs to other patients. As I say, there's lots of patients who need egg donation, but also can be donated to research projects, and research with egg, sperm and embryos really helps develop the technologies that we use and benefits future patients that might need fertility treatment.
Thank you very much, Marta. That's great. I think we might leave the other ones until the end because I'm just conscious of time here. So, Angela, I'm going to hand over to you now. Thank you very much.
Thank you. Hi, everybody. I'm Angela Pericleous-Smith. I'm one of the counsellors at the Bridge Clinic, and I'm chair of the British Infertility Counselling Association and counselling representative for British Fertility Society. Sorry, Marta, could you just put my next slide up, please? Thank you, and the next one. So I'll just quickly go through, and just to allow some time at the end, please do put your questions in the chat. Marta's gone through kind of reasons for people who egg freeze, and I think one of the things to kind of say is reiterating all of those reasons really, that sometimes people have additional embryos after fertility treatment as well and may freeze then. As Marta said, sometimes people are not ready to have a family yet for various different reasons, so kind of social or elective freezing. maybe for medical reasons such as chemotherapy or radiotherapy, and the kind of treatment that you'll be undergoing, and so you may want to come through beforehand to freeze eggs, and kind of gender reassignment and the hormones that you will be taking can really affect fertility. So again, kind of coming through and freezing eggs. One of the other reasons, perhaps through work, but you may have a career that you're at risk of injury or death, and maybe wish to ensure that your surviving partner will be able to use eggs in the future after their death, which I know Marta touched on with using after death. If you could have the next slide, please, Marta. I think what's really important to say, that irrespective of your reason for coming through and freezing eggs, whether that is an elective social reason or a medical reason, I think really important to say is that counselling is available and can also be very beneficial before treatment, whilst you're perhaps deciding whether it's the right thing for you to do, during treatment when you're actually going through the treatment process, or afterwards. So it's not always a case of you frozen eggs and that's it. Sometimes it can be really helpful to engage in counselling afterwards as well, so, and often raises emotions. So just bear in mind that counselling is available before, during and after treatment. Obviously, deciding to freeze eggs, whether to freeze eggs or not, can raise lots of questions, psychologically, emotionally, socially, financially sometimes, and counselling can really provide that space for you, that confidential space for you to kind of really talk out and explore what your thoughts and feelings are, and any concerns that you may have. Taking into account your personal circumstances, for example, is now the right time? What else is going on in your life at the moment? So it can really help to kind of help with your decision making for you. Next slide, please, Marta. So that real opportunity to think through, explore the information. When Marta was going through the slides, I was aware of kind of what she was kind of saying about the medical process of the actual treatment. So sometimes the counselling can be an opportunity to really explore that information you've been given and what that means for you. I often find that a lot of people I work with who are freezing their eggs or considering freezing their eggs kind of want their expectations managing, or help with how to manage their expectations. And I think just like to stress as well that research does show it as well, but that having counselling and emotional support can really help to minimise any regrets in the future, any long-term regret or dissatisfaction with freezing your eggs. Next slide, please. Thank you. So just kind of going back to expectations and managing expectations, I think thinking about what the benefit, and again, counselling and that opportunity, what the benefits are for you, what the limitations might be, what the long-term implications might be for you, your personal circumstances, and your family. Also an opportunity to consider how you might use your eggs in the future. I know storage timeframes have already been mentioned. Really vital to bear in mind that your intentions now may change over time. So you may come with one intention, and that intention may well change over time. And I think that question that was asked actually to Marta kind of reflected that feelings, intentions can change over time, and kind of the thought about what you might then do with stored eggs, what will happen to them in terms of using them yourself, donating them to other people, or disposing them. And also for partner using stored eggs, and sometimes that's in shared motherhood arrangements, and any legal implications. So that, again, opportunity to kind of thoroughly explore these and how these are for you. There's kind of a variety of reasons. Counselling can be beneficial before, during and after, very individual to your circumstances and how you want to use the counselling. I think I'm going to stop there just to allow for anybody who has any Q&A, any questions that they'd like to ask either myself or Marta, if that's okay, just aware of the time.
Thank you ever so much, Angela. I actually do have some questions, yes. So I'll just kick off with a couple, which I know you've sort of spoken to a little bit. One of them is, does egg freezing make you emotional?
Okay. Shall I take that, Marta? Yeah.
Yes.
Okay. I think what's really important to say is that everybody is so unique and everybody is so individual. As Marta said, you are having medical treatment, you are having hormone treatment, so it's not unusual to feel more emotional, maybe more teary, and sometimes that's useful to know that that can be a natural, normal reaction to the hormone treatment. I think, again, one of the things to remember is you are going through like an early part of an IVF treatment cycle.
Thank you very much, Angela. And I've got some more for you. So this is one around sort of practicalities, I guess. So it says, I've read I can do this around my work schedule. Is this true? Either for Marta or for Angela. I'll leave you take that one.
Well, it depends on the work schedule, I would say. But perhaps Angela can chip in. I think when you embark in this sort of process, you really need to make allowances in terms of time for coming to have tests and scans and consultations. And it's really valuable if your employer can be flexible around your needs during fertility treatment and, egg freezing. So I think it very much depends on what sort of work commitments and schedule people have, but people really need to make allowances for having time and mental space to come to see us when they need to. Angela, I don't know what your view is.
Yeah, I would agree with everything you've said, really, because it does really depend on what your work schedule is, as to whether it can fit around. And I think, that's something I would highlight, really, that this is going to impact on you. So it is important to have the time. It's not potentially that we sometimes see on social media or TikTok or something, that you can kind of come along in your lunch break and freeze your eggs and go off and back to work again. I know I keep stressing this, but it is a medical procedure that you are going through, and it's important to kind of really have self-care and good support around you. Make that space to come and attend appointments as well, and everything.
Mm.
Thank you very much. And I have another one for you as well. Now, would you recommend freezing embryos over eggs? It's a very good one, I think.
Yes, I think that's mostly for me. I think that very much depends on the circumstances of the person considering fertility preservation. Embryos, particularly for women who are over 37, give us better survival rates and better implantation rates. And so for that group of women, if they have the option of creating some embryos, whether they have a male partner or whether they want to use donor sperm. It is a good idea to do perhaps a proportion of the eggs with creating embryos and a proportion of the eggs frozen as eggs, and that might give extra choices later on in life. So I think, yes, embryos are good, but I think it's also good to have choices. So if people can, it is a good idea to store some eggs so that later on, if they don't want to have children with that partner that they had at the time, or if the partner is not willing to be part of that treatment, or if they no longer want to use donor sperm, but they have a partner that they want to use the eggs with, they have that option later on.
Very much, Marta. And I have another question here. I know you spoke a little bit to this bit earlier on, but the question is, how many eggs can I expect to freeze?
So, I mean, that depends on how well people respond to stimulation. So on average, across all ages, we collect 11 eggs per woman. Now, of course, older women respond on average worse to stimulation and younger women respond better to stimulation. In general, for egg cryopreservation, we recommend to freeze for women under 37 between 18 and 20 eggs. So that sometimes might mean 2 stimulation cycles. But as I say, it's very much depending on how the person responds to stimulation and what the ovarian reserve is. Not sure whether that answers the question.
I think that sounds like a comprehensive answer, and I've not seen anything else in the chat on that one, but I'll keep an eye out, Marta. Thank you. And we might have time for maybe one or two more. This one is probably a one for Angela, I think, actually. Do people regret freezing their eggs?
Well, the studies do show that some people regret freezing their eggs, and I've never actually worked with anybody that's regretted freezing their eggs. But some of the research does show that, yes, some people do regret freezing their eggs. And but as I say, kind of the studies also show that having good emotional support in place and engaging in counselling does minimise that long-term regret as well. So I think that's kind of fair to say.
Thank you very much. And we might have time for one more. I think I'm keeping my eye on the clock here. Should I freeze my eggs as an insurance policy? I guess this could be taken by either of you, so I'll leave you to discuss this one, maybe.
Angela, you go.
Okay, well, I would just say from my point of view, you know, as a counsellor working with people and psychologically, you know, as Marta's kind of gone through kind of the figures, success rates and such, future use, lots of people do view it as kind of an insurance policy, but I think, again, the kind of real importance of understanding what an insurance policy kind of means, that, you know, having your eggs frozen gives you that opportunity of trying for a family in the future, but it doesn't guarantee. So in some ways it is a bit like an insurance policy that you pay into, but you're never going to guarantee getting a payout from it. But it obviously it gives lots of people that reassurance that their eggs are frozen and they've got the opportunity of trying in the future. I think, you know, that's how I would respond. I don't know if you would say anything different, Marta.
I would call it a backup plan rather than insurance policy. So it's something you have, and it might give you some peace of mind throughout the years, but it's never to think that you're guaranteed to get a baby out of the eggs that you might have in storage. You might have a certain chance, and we will give you that chance based on your age and the number of eggs in storage. But that chance is never, 100%, and it's never a guarantee. So it's worth people knowing that it's a good backup plan, but perhaps no guarantees. Yeah.
And the thing is, it's an option that is available these days that, decades ago wasn't available. So it is an option.
And on that note, I think we will begin to round up the webinar for this evening, as sadly we're out of time. So I'd like to say a huge thank you to all of you for attending this evening, and especially to Marta and to Angela for such an informative and enjoyable 45 minutes or so. If you have any further questions, please do get in touch with us. You know the link to our website, but we'll say it again, bridgeclinic.london. We'd be really, really happy to hear from you, and it would be great to have a chat. So thank you ever so much, and we'll bring this evening's session to a close. Thank you.
Thanks, everyone.